profession as also a public health specialist. I also lecture in public health at the University of Technology. I mean, the coronavirus since December has been having effects primarily initially in China, and then it has spread to other countries. I think it was inevitable based on the type of country that Jamaica is, the type of world that we're in now, where people are traveling a lot, for us to eventually have had, coronavirus. So, it was inevitable because a lot of people are traveling, a lot of people live in diaspora, people travel for work, etc., that we would have had some cases.
So do you think that was the main problem of the Jamaican government, so still allowing flights from certain countries?
It is impossible to ban every single flight coming into Jamaica because it has implications on, just basic things that we do. We need food, we need supplies, even medical supplies from our hospitals. All these things are imported, so it's not practical to ban every single flight. But what I think the authorities have been doing is looking at where the majority of cases are, and they've imposed restrictions based on that information. And that's a practical approach. So we've certainly had many epidemics in Jamaica. So an epidemic for us usually is when we have our chickpea, zigpea, dengue most recently. We've had seasonal outbreaks of the flu and cold symptoms. So as a practitioner, I've experienced those, and because I've been practicing for over 10 years, so I've experienced those. As a pandemic, as a global pandemic, the SARS, I think H1N1 was declared a pandemic some years ago, but fortunately for Jamaica, we were not severely affected. And we're hoping that with COVID-19 that we will not be as badly affected as some of the other countries. I think a lot of persons are concerned. Some persons are panicking, are panicky. I get a lot of messages and calls asking, what should I buy? How much vitamin C? People send me a list of medication that they want to buy. People are saying they don't want to work, they don't want to, so a lot of people are, worried. Particularly persons who have other illnesses, so the more elderly persons in our society who are more vulnerable, and also persons who have like the chronic illnesses such as diabetes and hypertension. So some of them are more worried. People are worried whether they should buy masks, whether they should, all those concerns. People send me all kind of information about whether garlic or.
Right now, them I say the baby them and the elderly people them faster for catch it because they're using 16 week.
Different substances that they think that will cure them or prevent them from getting the virus. So the recommendation so far has been not that everybody should wear a mask. It is useful if you are having symptoms. So if you're having a cough and cold, you should be covering so that the droplets don't, spread to other persons. But the recommendation certainly is not for everybody to be wearing a mask. What happens that when most people start wearing a mask, they touch their face much more often because it's not something
that the type of mask, because I'm seeing that here.
And you should be an N95 mask. That would be the mask recommended.
Okay.
But certainly that's not the one that I see people out there using.
Here, dust mask.
Dust mask, I see people with
bottles.
Bottles, people have a mask with a hole that they can drink out of, and all these things. It might be funny for social media, but it really is not a protective measure. People have, most of the myths that I've heard have been surrounding cure. People say different concoctions, so X amount of garlic.
Germans have cut up the garlic because they say garlic and anchovy biologic.
X amount of different substances that it will cure you, and if you take it in a certain amount of days and all that. Those are a lot of the myths are about that. It's just not evidence at this point that those are true. I would suggest that persons listen to reputable sources for their information, usually WHO's website, the Ministry of Health, CDC. They produce reputable information that you can follow. That can be done. I think they have done a very good job in terms of providing information. But there is a famous politician that says beautiful speaking is just one part of the equation. You require action on the other part. Now that we have COVID-19 in Jamaica, it requires a series of actions that is going to ensure that the population is, one, protected, and two, if the cases emerge, that people are treated and are able to get treatment. That is, so the proof of everything now is the testing point, whether or not the measures, they have sufficient supplies in place, do they have plans in place that they can activate and mobilize supplies quickly in the case of we having widespread disease in the society. I know there's a lot of concern based on our experience with dengue and chickpea that might not be in place. So I think people are worried about that because the health system has been under strain because of the dengue outbreak that we're basically coming out of. So people are worried that you have a system that has been under strain for a while, and now we're going to be faced with a big, if it extends widely, with a big, epidemic. So there's some concern about that. But I think the ministry would be wise to look at some of the examples, countries like China, South Korea, who have done well in terms of managing their outbreaks. I think we certainly need to improve our testing capability, even though we can test for COVID now in Jamaica. The testing that is available is still not widespread. It seems like the testing protocol for the ministry is focused on people who are severely ill, but we still need to capture more people, so we probably need to improve those capabilities. And I think greater partnership with the private sector can help to improve some of that. So those are some of the areas I think they need to focus on and have plans to ensure that if we need to mobilize more hospital bed space, that those things can be done. So you realize countries like China had to build makeshift hospitals to treat people. I don't know that it might be there, but certainly that has not been communicated to the public that those plans are in place for those things to happen in Jamaica if needs be. Panicking won't help. That's the first reason. Panicking won't help. It will only place you and your family at more risk and additional stress, put you at additional strain. Secondly, while this is a new virus, most persons, if they become infected, are going to have mild symptoms, and most persons will recover and be okay. For the about 20% of persons who might have severe illness, even with those persons, the likelihood of them surviving and doing well is higher than other diseases. So it is not that it's not a serious disease. It is not that you do not need to ensure that you're protected and have measures in place, but you might be affected in a mild way, and for the persons who are affected severely, the majority of them will do well. The best measures we can do is to protect ourselves, our families, ensuring that we have plans in place, keep informed, ensure that we stock up on supplies for those who have chronic illnesses, ensure we practice proper hygiene, proper social etiquette in terms of cough, etc., etc. Ensure that we use our hand sanitizers if we are not able to wash our hands. For persons, there are some persons who have been stocking up on cleaning supplies. Cleaning around the house is important. I know people are like a particular brand, but regular bleach has done its effect over time, so you don't have to go to the expensive brands. Just ensuring that we're clean and stuff at home is important. If at this point you don't need to be in large gatherings, then it should be avoided. So you can limit your own activities in relation to that. Internet and social media has certainly assisted, so a lot of us can do online meetings and different face chats and all kind of stuff. So we have those tools at our disposal, so we should use them. And most of all, keep informed. Ensure you keep your healthy diet, do your exercises at home. It's not probably a good advice nowadays to be utilizing public gym facilities, etc. So you have to have your own exercise regimes at home. I think those are the measures that will protect us. Once the virus has passed through, you realize that things will slowly go back to normal. But for the time being, those are the things that we need to do.
Okay, so thank you, Dr. for those tips. I would normally shake hand, but
yeah, that's fine. We can elbow.
Alright, thank you.
You're welcome.